Hello, my name is Angelina Savarese, and this is my Module 5 discussion. So, our example person is Victoria. She's known to be a couch potato, and she goes for a jog. Her face turns red, and she starts to sweat. What's happening with her heart and her cardiovascular system? Her heart will begin to contract faster, her heart rate will increase, and her arteries will expand. The heart rate would be expected to increase so that she can replace her building levels of carbon dioxide with the oxygen that she's breathing in. So the more the heart beats, the more blood is pumped to the lungs to replace the CO2 with O2, and then the oxygen is pumped in the blood to the rest of the body. Her arteries would become vasodilated, and this is what vasodilation of an artery looks like, and this is what a normal artery would look like at resting. And then this allows for more blood volume to be pumped through the body. And then we have the precapillary sphincters, and this is what the capillary looks like at rest. And then these precapillary sphincters open up to allow more the increased blood volume from the heart rate to go into the capillary beds and into more tissue that need more oxygen. So because the capillary beds are so thin and it's embedded within these tissues, it will make the face look red, and it will make the thighs look red too. And the primary organ systems that need this amount of blood flow would be the respiratory system, the cardiovascular system, the nervous system, the muscular system, and the skeletal system. And then some low priority organ systems that do not need all this blood would be the lymphatic system, the urinary system, the digestive system. And this is all done through the autonomic nervous system. All this heart activity is done through the autonomic nervous system. Epinephrine would be the neurotransmitter that is released the most from the neurons, and it deals with the contractility of the heart and the increased heart rate and the expansion of the arteries. So her respiratory rate and pattern would both increase, and her bronchi would go through bronchodilation, which is the expanding of the bronchi. So this is done through smooth muscle, which is here and here. And the smooth muscle is found on the trachea, the primary bronchi, the secondary bronchi, the tertiary bronchi, and the terminal bronchioles. All of these little areas. And then this is all a part of the conducting zone. And this is a part of the autonomic nervous system also. So when you exercise a lot, you have immediate and long-term health benefits. So you would have a decreased resting heart rate. You would also be able to have longer, deeper breaths. And you would decrease your chances of getting cardiovascular diseases in the future. Some mental health improvements would be in your mood and concentration. And because of this improved circulation, you'll be able to bring more oxygen to your tissues and other organ systems, and this will improve those systems. And then we have the vital signs, which are right here, and we're going to go through these 7. So we're going to start with the carotid. The carotid is inferior to the jawline, lateral to the trachea, and anterior to the sternocleidomastoid. It's going to be right here. You palpate with 2 fingers. You don't do both because you're going to cut off circulation to the head, and we don't want that. Then we have the brachial artery, which you can find if you flex your arm, find the belly of the biceps brachii muscle, go to the distal end of that, and then extend the arm. You would find that here. And then the radial artery, think of the radius is the bone attached or on the bone side of the thumb, because your radios need antennas and your thumb is an antenna. So 2 fingers proximal to the wrist, right here. And then we have the femoral artery, which is between the pubic symphysis and the anterior superior iliac spine, and is right here deep to the inguinal ligament. And you have to palpate kind of hard for that. And then we have the popliteal artery, which is at the posterior knee, and which is like the midpoint of the popliteal region. And then we have the posterior tibial artery, which you can find at the medial malleolus, which is the bony protrusion of the ankle. Posterior to that, 2 fingers, go lightly. And then finally, we have the dorsalis pedis artery, which is between metatarsal 1 and 2. And I'll get it there. Thank you.